I'll give you a brief history of the coronavirus. This virus has been around for about 5 decades. We have known about it since 1950s and 60s. There are 4 main types, as you have seen written here: HKU1, NL63229E, and OC43, which all cause a simple common cold, which means they only cause upper respiratory symptoms in the form of runny nose, heavy head, and maybe a little bit of a sore throat. But in the year 2002, the first mutation occurred whereby the SARS coronavirus 1 was seen originating in bats, and this caused the epidemic the SARS, or severe acute respiratory syndrome. About 8,000 people all over the world were involved and 800 people died. It had a mortality of about 10%. Subsequently, in the year 2012, the Middle Eastern respiratory virus syndrome was detected. This arose in Saudi Arabia, again from bats, but this time through camels, which were the intermediary host. It caused a very similar illness to the SARS, whereby instead of just causing upper respiratory symptoms, it also led to pneumonia. And this had a much higher mortality of about 35%. On the whole, about 2,500 people around the world have been involved. We still see an occasional case of MERS, and about 35%, which means about 800 people died. In the late part of 2019, the third mutation occurred in the coronaviruses. This also originated in bats, and then through an intermediary host, which is believed to be the pangolin, has affected humans, resulting in a pneumonia, and this has a mortality rate of less than 1%. So it's actually not that severe in its outcomes, but the fact you have to understand is this is highly infectious. This is several times more infectious. And when you compare it with the SARS, to which it is very often compared with, the SARS of 2002 actually became infectious 4 days after the person manifested symptoms. So if I started developing fever today, I became infectious to others only 4 days down the road, whereas the SARS coronavirus 2 or the COVID-19, which we have now, actually becomes infectious even 2 days before onset of symptoms. So if I have fever today, actually I have been infecting people from Tuesday itself. So this is a very, very worrying issue, because by the time I am detected, already I may have passed it on to several people. We also compare the COVID-19 to the seasonal flu. Earlier it was belittled, saying that this is just a slightly worse form of flu. But if you compare, the R0, or the number required for one person to infect others, was actually 1.3. So only one person who has the flu can infect statistically another 1.3 people. But if you look at the COVID-19, one person can infect up to 2.5 persons more. So this is far more infectious than the flu. The flu has a shorter incubation time. The incubation time, which refers to the time after which I have got the infection and for me to manifest symptoms, is as long as 14 days. So I may have picked up the infection 10 days ago and may develop the symptom today. The hospitalization rate for flu is only about 2%, whereas almost 20% of people who develop COVID can require hospitalization. And the case fatality rate is 10 times more. 0.1% is for the flu, and this can be as high as 1%. So this is not a simple, slightly worsened, severe form of flu. This is much more severe because of its high infectivity and the high hospitalization and mortality rate. Even though the typical symptoms of COVID is fever, sore throat, and developing progressive breathlessness, there are a lot of other symptoms which manifest in several people. Some may have only cough, some may have no fever and just a shortness of breath after feeling unwell for a few days. Fever may be typically seen in some people. Chills, headache, body pain, sore throat, loss of smell and taste. This is very typical of COVID when it is seen in people currently with or without fever. This is usually seen in young people, especially young women, and has a very good prognosis, which means the people who develop loss of smell do recover very well without other complications. The main question, I'm going to run through some questions before I look at these scenarios. When do you test? A lot of people ask me every day, I have a little bit of sore throat. Should I do a test? I have some headache. Should I do the test? I am feeling feverish. Should I do the test? What is recommended is, because I told you this becomes infectious even 2 days before the onset of symptoms, whenever you suspect that you may have symptoms of either sore throat, headache, body pain, loose stools, loss of smell, fever, whenever you develop any of these symptoms or symptoms you think may be COVID, the first thing you do is you isolate yourself at home. So choose a single room, make sure that if it has an attached bathroom, well and good, but close yourself down. You don't leave the room. You don't let other people enter the room. If somebody has to enter the room for whatever reason, make sure you and the other person are always masked. So this is the first thing you need to do, and see if your symptoms last more than 24 hours or so. If you persistently feel feverish, persistently have a fever, have a severe sore throat, have severe body pain or headache and feel unwell, then you approach a doctor to consider whether you need a COVID test or not. So this would be the sequence of events whereby you need to first isolate yourself before you even consider anything else. I'm going to show you a picture which may seem a little medical and complicated, but I just want to tell you that the chance of the test being positive depends on what we refer to as the pre-test probability. That is, before doing the test, if we think that the chances of having COVID is high, which is what the scenario is right now in Chennai, because there is a lot of cases going around, the chances of a positive test is very high. But please remember that the test has almost a 40% negative predictive rate. In other words, out of 10 people, 6 will definitely be positive, and up to 4 people who have the infection may actually have a negative test. This is because of the way the test is done and also operational reasons, which means now, if the chances are low, almost 65% is only picked. For 35% may have a negative test. Whereas if the chances of the test being low is higher, that is, I'm doing the test just because I'm traveling somewhere and I want to do the test just because I need to make sure that I have the infection, and the chances I've been quarantining myself for 2-3 months is going to be low of having the test, then even if the test is positive, sometimes the test may be false positive. Now, these are things we don't realize, in which I get a lot of patients who come typical with symptoms of flu, but they have a negative test and the doctor advises they need not be isolated and they can be normal. And this sometimes cause the infection to be spread among the household contacts. So please remember, no test is foolproof. We have to mix the clinical picture and the test results to decide how strongly we have to approach the person as having COVID. I told you the infectivity, this is far more infectious than the flu. The infectivity starts 2 days before the onset of the illness, and in patients with mild infections, which means people who have a little bit of a fever, have a body pain, who don't require hospitalization, or even if they require hospitalization, they may require oxygen for a day or two and then recover. In general, they are no longer infectious after 10 days of onset of symptoms. So if I start symptoms on the 25th of August, by 4th of September, I am no longer infectious. But to be on the safer side, we advise that people quarantine for 14 days so that by 14 days, we definitely know that they are no longer infectious to other people. Another question asked is, do anybody who tested positive require retesting? No. Currently, we don't go by test-based diagnosis to decide whether the person is no longer infectious. We go by a time-based approach, which means for mild infections, beyond 10 days, they are no longer infectious, and beyond 14 days, we ask them to go on to lead a normal life. But those who may have a severe infection, who require hospitalization, end up in the ICU, end up on a ventilator, they may shed the virus for longer, sometimes 15 to 20 days, and we say that beyond 20 days, they are no longer infectious. We don't advise retesting because the test not only detects the live virus, it also detects dead virus, which means because when you cough up and parts of the lung tissue may come out through the sputum for several weeks, the test may remain positive in some people with infections for up to 6 weeks. So retesting is no longer advised to ensure that you have cleared the infection. If the time beyond 10 days is gone, We assume that you are no longer infectious. Can there be a recurrence of infection? No. Amongst all the millions of cases which we have seen so far, there has been one case reported last week in a person who may have had a reinfection. This is probably due to a mutation or a change in the virus. And as far as now, if you get the infection and recover, the chance that you may have immunity and not get a reinfection for at least 6 months is reasonably clear. We still don't know what happens 6 months later. If I develop the symptoms of typical COVID, I have fever, body pain, maybe a sore throat, and after a couple of days, I feel better. Does it mean that I can go back? No. If we strongly suspect COVID, you may be infectious, as I told you, for at least 7 to 8 days, which means you still need to quarantine yourself for up to 10 days if there is a strong suspicion of COVID. Please remember, if you feel better in 2 days, you cannot go back to being normal, because you may be normal, but you may be still infectious to others. Another question asked is, when do you admit? Because a lot of people get worried when they develop COVID. Should I immediately go to the hospital? My father has high blood pressure, diabetes, and has also had a heart disease. Does it mean he may have higher complications? Yes, it does mean that he may have higher complications, especially if he's over the age of 60. But that does not mean that everybody who has problems and comorbidities, as we call, needs admission. Admission is currently recommended only for people when you monitor the oxygen saturation and it drops to less than 94% consistently, then you need to admit them. Oxygen saturation checking is only for people who have COVID, not for healthy people. You and I don't need to keep checking our oxygen saturations thrice a day and feel happy that it is above 94 or feel worried if it drops less than 93. It is only for people with COVID. So please don't waste your time buying an oximeter and keep checking it every day to make sure that you're all right. It is only with people who have COVID you need to check, and if it drops less than 94, you need to hospitalize them. Otherwise, if you are dehydrated, if you're dizzy, if you're feeling very weak, these may be hospitalizations, not others. Lastly, where do you hospitalize? You have a wide range, right from government to
okay, fine. Okay.
To private hospitals. Getting an echo here, so maybe somebody needs to mute.
You are muted, Ramasubramanian.
Depending on the money you need to spend, you can decide which hospital, but most of the hospitals give reasonable care. I think the earlier question of private hospitals charging too much has now been reasonably tempered, and it should be all right. But still, beds are very difficult to come by. So we still, at least in Apollo Hospital, we reserve it only for people who definitely require hospitalizations and not because they are worried or panicking at home. Some of the myth busters. Is there a connection between food and COVID? No, there is no connection, vegetarian, non-vegetarian. There is no spread or concern or specific restrictions for food in people with COVID. Does a non-vegetarian cuisine increase the risk of getting COVID or avoided during COVID? Nothing. Food, again, I repeat, has no connection with COVID. The earlier concern, vegetables, newspapers, milk packets may transmit COVID because the person who delivers them may contaminate it inadvertently if he is asymptomatic. The chances of spreading through fomites, that is inanimate objects, is very, very small. It is predominantly transmitted from one person to another through small droplets to which the virus sticks. So generally beyond 1 to 2 meters, it does not spread. And this is the maximum chance of being spread. As long as you wash a milk packet, or if vegetables or milk packets, if you're handling newspapers, you wash your hands after reading the newspaper before you go on to doing anything else, is all that is recommended. Vitamin C and zinc are being consumed in industrial quantities right now by most people with the idea that it will help keep them healthy and especially help if they have COVID. There is no medical evidence to say that zinc or vitamin C helps in either prevention or making somebody's immunity stronger. These are all assumptions based on 1 or 2 studies. We have no definitive evidence. What about immunity building? A lot of people take various things with the good intention that it will build immunity. As of now, there are only 5 things which are medically proven to improve immunity. 1, a balanced, nutritious meal. 2, rest of at least 6 to 8 hours a day for most people. 3, physical exercise so that you keep physically strong and avoid, keep your immunity strong. 4, take your adult vaccinations, which means periodic boosters, whether it is tetanus, whether it is pneumococcal vaccine, whether it is flu every year, that will help. And most importantly, decreasing your stress levels. Stress is directly associated with suppression of your immune system. So the lower stress you have, the stronger the immunity. And again, there are no prophylactic or preventive medicines in helping you to prevent the infection in yourself or in ensuring that you to others. Though the ICMR has recommended hydroxychloroquine, again, there is no definitive evidence to say that hydroxychloroquine, if you take, you are protected from the infection. Another concept which was popular was what is called flattening the curve. Now, I'll explain it to you simply that this would be the red curve is that which would have occurred without any protective measures. And you'll see that if you take this healthcare capacity, if suddenly you get 10,000 people within 1 month who have severe COVID requiring hospitalization and ventilation, as which happened in England, in New York, or in Spain, in Italy, a number of people would end up dying. Whereas if you put in measures to flatten the curve by minimizing the transmission, by ensuring that lockdown is put in place, affected, but this happens over 3 to 4 months. So your healthcare system is able to compensate and the delivery is better, which is what has happened in India. We managed to flatten the curve. So even though the number of cases are still going on, we are treating them better. So this is very important. And this was seen as early as 1918 during the Spanish flu, when they brought in a lockdown. And this is the lesson we learned. For example, in Philadelphia, where the first case was seen on the 17th of September, and lockdown was introduced on October 3rd, which is 2 weeks later, the number of cases which surged was resulted in more than 250 deaths for 100,000 people. Whereas in St. Louis, the lockdown was introduced 2 days after the first case, from 5th of October to 7th. And you'll see that they flattened the curve and the number of deaths was significantly reduced. So what do you mean by it is actually not social distancing, it is physical distancing? What do you mean by that? You avoid group gatherings, concerts, theaters, malls, gyms, and it is safe to go for a walk alone, to go for a hike, work in your yard, play in your yard, read a book, listen to music. In other words, you physically distance yourself from others, because the more closer you are to others, the greater the risk, because there may be asymptomatic people who may transmit it. So what do we mean by home quarantine? I told you, you isolate yourself at home if you feel unwell. That means stay in a well-ventilated room, away from elderly people and children and pregnant women. Restrict your movement within this area. Under no circumstances attend a social gathering. Wash hands frequently. Avoid sharing household items. In the presence of others, wear a surgical mask. And if symptoms appear, seek help from a doctor. I have had patients who tell me, oh, doctor, I have been completely isolated for the last 4 days. So then I ask them, how did it spread to your parents? They say they don't know. But when I ask them, what about lunch? Oh, only lunch they come and eat in the dining table. Otherwise, they are always in the room. Now, that is not quarantine. Quarantine means you stay away from everybody, at least 6 feet away, period. We have also seen during the earlier part of the pandemic, masks were recommended only for healthcare workers. Masks were not recommended for people in general in the community. So the earlier part, we were not using masks, but subsequently we realized that masks made a difference. This slide tells you how is that if this person is infected without a mask, even if other people wear a mask, the chances of minimizing the infection is lesser. Whereas if both of you wear a mask, the chances of reducing the infection is significantly brought down. This is very evident from countries like Korea, Japan, Singapore, and Hong Kong, which have a culture of masks, showed a lesser incidence of the infection when compared to the European countries where they don't wear masks, and that caused greater spread of infection. In fact, this picture very clearly shows that if a person with COVID does not wear a mask and somebody healthy wear a mask, you can reduce it to 70%. When the person with COVID wears a mask, you can reduce it to as low as 5%. And when both of you wear a mask, the transmission is just 1.5%. So this tells you how important it is wearing masks. The next question, what masks? The N95 is generally recommended only for healthcare workers. Unfortunately, we see most people out in the community wearing this mask. This mask has to be fit tested. It has to very snugly fit around your nose and chin. We see people wearing loose masks. They use the masks for 2 weeks, 3 weeks at a stretch. These are masks which are to be worn for 6 to 8 hours and disposed, which people don't know. Surgical masks is as good, almost as good as N95, again for healthcare workers and people who have the infection. Most of the others can wear a triple layered cotton washable mask, which helps protect up to almost 70 to 90% in most situations. So please remember, for public, a simple, washable, surgical, triple layered mask is what is recommended. The surgical mask is disposable, 6 to 8 hours, and the N95 is also a disposable mask beyond 6 to 8 hours. But unfortunately, people don't know this and they use it for several days, which defeats the purpose. A surgical mask becomes useless if it is wet or soiled. You have to keep that in mind. We also have to avoid physical contact. Handshaking should be avoided. The good old namaste is what is now we strongly recommend. When you come to a door, do not touch the door handle. Use your elbow or your back to open the door. If you are using a lift, again, using an elbow is preferable to using fingers, or you sanitize your fingers with alcohol sanitizers after touching public places. Similarly, an escalator or a stair, do not touch anything. So when you're out in the open, in a marketplace or wherever, keep your hands to yourself. Do not touch your face, because even handling your mask is risky, because the outside may have the virus if somebody else has been infected close to you. Use only the strings or the elastic to handle the mask. Do not handle the mask through the handling the front of the mask. What about prevention at work? This has been graded on effectiveness, highest with lowest effectiveness. Highest effectiveness is ensuring that you are physically distanced from anybody. Engineering control is like creating barriers. So for example, several companies in their lunchrooms where you cannot wear a mask, you are eating, there is somebody next to you is eating, you put a plexiglass partition between the two of you so that there is no spread of droplets between the two of you. Administrative responsibility is to reduce the number of people, and protection, even though mandatory mask use is very, very inexpensive, this probably is one of the best ways to manage people when they have to congregate for whatever reason. Other simple measures for people who have companies and who have people working for them, or if you work in offices, increase or encourage natural ventilation. It is not the air conditioner which is at risk. It is a lack of ventilation in air-conditioned rooms which is risky. So ensure, even if you have the air conditioner on, ensure natural ventilation so that there is circulation of air. Physically distance people and seat them in a diagonal fashion so that they don't directly spread droplets to people in front of them, and spread the people around. Avoid concentration of employees in meetings, have virtual meetings, and ensure that people do not congregate, whether it is meetings, whether it is cafeterias, or in other areas of the office. Please remember that apart from open windows, also increase the distance of people and avoid background music. It is seen that when there is background noise or music, people tend to talk louder. When you talk louder, there is a higher chance of droplets coming from your mouth, which can be infectious to others. So these are simple ways ensuring that ventilation is increased, keeping functions or meetings outdoor where there is a much better chance of ventilation is what is strongly recognized, strongly encouraged. Another question which people ask me is, when will this pandemic end? I tell them there are two ends to a pandemic. One is called the social end to a pandemic, which we have already come across. The social end, all in Chennai in India, we have come across the social end where we have learned to accept the pandemic and move on with life. Whether you go to a market, whether you go to work, I see people, all of them with masks around their necks and talking and congregating in close proximity. This is the social end. The medical end to the pandemic will come in two ways. One, through natural infection, you reach what is called a herd immunity. Now, what do you mean by a herd immunity? Now, if you look at the blue color, which are people who are not immunized and who are susceptible, and you get a person who is red, who is a sick patient, he can spread it to all the people around him. So you find that in a short while, a lot of them have the infection because of these few people who are infected. Whereas if you reach a situation when a significant number of people who are infected recover from the infection and become yellow, even if you have one or two people who are red and who are infected, you cannot spread it in the community because the blue ones who are the susceptible people are protected by a lot of people around who already have immunity. This means that if about 60% of the population are infected and have recovered and they have natural immunity, this 60% will protect the other 40% within their same community because the transmission will not happen that easily. So this is called herd immunity. But unfortunately, to reach a 60% rate in the community and people to recover, a number of people will die on the way because 1% of people may die. So herd immunity through natural infection is not a good idea. So the only other option is the vaccine. Now, there is a lot of hype about an early vaccine being available, but realistically speaking, I don't expect the vaccine, a good effective vaccine, to come within 1 year. And even if it does, the chances that it will be available and accessible to a significant number of the population is very, very small. You can't expect 6 to 7 billion people in the world, vaccines to form, 3 doses of vaccines over 6 months, which is what is expected, will happen soon. To give you an example, it takes anywhere from about 8 to 10 years on an average to develop a vaccine. This is the preclinical stage, then there's phase 1, phase 2, phase 3. By the time it goes through all these studies, in normal span of events, it will take about 10 to 13 years. For the Ebola vaccine, they fast-tracked it and brought it in 5 years. For the Zika infection, they brought out the vaccine in 2 years' time. So if they bring out a vaccine for coronavirus in 1 year, it will be a phenomenal miracle. But even then, it may not be available to a lot of people in the world. There are a lot of private-public partnerships which are looking at vaccines. You'll see the number of companies and developers who are investing in vaccine, but still it appears it will take time. There are several vaccine candidates, 5 from China, couple from the United States, a couple from UK. It appears the Oxford vaccine, which is being combined in partnership with Serum Institutes of India, is likely to be very useful and come out soon. But as I said, I have a little reservation in whether it will be available soon, and even if it is available, whether it will be effective enough. It should be at least 50 to 70% effective to help you prevent the infection. And even then, will it be available to a significant number of Indians? We have to wait and see. This is, a busy slide, but it tells you what is acceptable. The low risk is when you are staying at home, when you're walking outdoors alone, when you're ordering foods, when you're biking, running, and outdoor picnic is all reasonably safe. Whereas you look at going to a bar or a nightclub, playing contact sports, partying, air travel, public transport, concerts, religious services, and a movie or a theater, all of these are high risk. So you'll find that the lockdown, as we call it lockdown 1.0, 2.0, 3.0, 4.0, we are now coming to 5.0. This process has basically been slowly relaxing these. So first we could only do this. Now I think they are opening up, play areas, shops are being. The medium one is hospitals, emergency department, dental appointments, taxi. We have come here very soon. I think not very soon. Gyms have already opened with limitations. Hair salons have opened. Restaurants is not yet open, but you can see that there is a gradual relaxations in the lockdown, and probably lockdown 5.0 will also relax several of these. We have to wait and see. When will we have a cure? A very, very pertinent and a question which a lot of people want to know. If probably we have Patanjali coming out with a cure. We should probably do it in the next 1 month. All the pharma companies are struggling to find an answer, and we still don't have one. There are several indigenous medicines, including homeopathy and Ayurveda, which are promising miracle cures. I have a lot of skepticism about it, but I think it is going to take time. But what matters is discipline. Discipline is the key to keeping yourself and others safe. This boy, you can see, he may be naked, but he is ensuring that he is protecting himself and the others. So that is what is needed. Physical distancing, universal masking, washing hands frequently, avoiding taking your hands near your face, coughing and sneezing to ensure that you do it in your elbow so that you don't splatter the droplets, avoid spitting, work from home, stay at home if sick. Most importantly, stay at home if you're sick. If you're doubting that you could have a problem, you stay at home so that you don't spread the infection. Cleaning commonly touched public surfaces with diluted bleach and sodium hypochlorite, and limiting travel. These are the ways to ensure that we keep ourselves and our community safe. The most important would be distancing and mask. When we go near somebody, we pull it down and start talking. It defeats the purpose of wearing a mask. So this is what I think we need to keep in mind. And if we adhere to these principles, I think we can stay safe. And probably we will definitely learn to live with the corona. We have done in the past, and we can definitely do it in future. Thank you very much. Yes, I think I've cleared, and now you can go ahead with any questions you think you need to know the answers for.
Thank you, Dr. Ramasubramanian.
Hello, thank you, Dr. Ramasubramanian. I now request Dr. Praveen and Dr. Madhu to coordinate the question and answer session.
Yes.
Thank you, Dr. Ramasubramanian. It was most enlightening, and I think you have thrown away most of the myths involved in this corona during this past few months. We will request the Rotarians and guests to post their questions. There's a question from Daksha: is the thermometer more useful than this thermoscan?
The thermometer gun is very safe because you keep it away, you don't touch anybody. So it's usually, you cannot stand 4 feet away and fire the gun like James Bond. You have to go close and probably 4 inches or so away. That is more reliable. But having said that, there are limitations to the effectiveness of this infrared gun. Nothing is more accurate than keeping a thermometer in the mouth or in the axilla. But still, it has a reasonable effectiveness, and I think in public places it should be used. Make sure that you calibrate it and it is effective, but it is definitely one deterrent, or ensuring to make sure that people with fever don't come into public.
The question from Ratna.
Good evening, Doctor. Good evening, Doctor. Thank you. Such an insightful, witty, and very, very interesting.
There's a lot of echo, ma. There's a lot of echo, ma. Ratna, a lot of echo.
Doctor, my question is. Hello, Doctor. My question is. You said we can exercise, and so while you put a mask, is it allowed to wear a mask and run?
Please unmute. Unmute panel.
I am not in favor of routine masking for exercise. I would say if you're going for a walk, if you're going for a jog, you choose a time and a place where there is no crowd so that you are not putting anybody else at risk nor yourself at risk. If you are in the gym where heavy weights again is not advisable. In the gym, I would suggest 2 things. 1, ensure that there are very few people in the gym so that there is no crowding. And 2, ensure that there is good ventilation. As long as there is good ventilation, there is no issue. Because when you are exerting yourself, when your body requires more oxygen and you cover your mouth and nose, especially for the people who are over 50, it is not a good thing to do. So choose a place where you can be safe. If you're doing a walk in public wearing a mask is acceptable. But if you're jogging, if you're physically straining yourself, I think you should do it without a mask in a place where you're not going to, cause harm to others or to yourself.
Thank you. Thank you so much.
Welcome.
Welcome,
Welcome,
DG.
DG.
Welcome, our DG.
Welcome, sir.
Ramasubramanian, there's a question from Mrs. Larita Rai. She wants to know what is your opinion about FabiFlu?
Now, FabiFlu is the trade name for a molecule which is called Favipiravir. Favipiravir is an oral antiviral which has shown some effectiveness against the SARS virus. Having said that, the data on its efficacy for COVID-19 is very, very minimal. For mild and moderate cases, it has shown some benefit in a few studies. But when you look at most people with mild or moderate disease are going to recover anyway, has the tablet made a difference? We still don't have significant evidence. As I told you, there are a couple of studies to say that it probably helps, but I wouldn't routinely recommend FabiFlu for outpatient treatment. I'm not convinced yet. We still need more evidence before it can be recommended widely.
Thank you, Doc.
Question from Ramkant. Please unmute.
Question because
Hi, doctor. This is Ramakant from RCM.
yes.
Doctor, my question is, my whole family who reside in Hyderabad tested positive. My brother, his son who is 18, 19 years, his daughter 13 years, his wife, and my mother 79 years. So all of them tested positive in Hyderabad. They were home quarantined for almost now 21 days. And just now we got them retested and the results have come. Leaving my brother's son who is 18 years, everybody is negative. So how is that possible that only my brother's son remains positive, everybody is negative? So how much can we depend on this RT-PCR?
Now, as I told you before, the RT-PCR is effective about 60 to 70% of the time if you do a nasopharyngeal with an oropharyngeal swab together. And as that means that still 3 out of 10 who are positive the test. I also told you that repeating a test is not warranted anymore. We no longer repeat the test because we know that the test may sometimes detect the dead virus, which may be present for up to 4 to 6 weeks. So I'm not surprised with the reports. Sometimes 2 out of 4 will show positive on retesting. Sometimes 4 out of 4 will show positive on retesting. Retesting is not recommended anymore.
What about the antibody test, Ram?
The antibody test is also not very well validated. Seen even after 5 days of onset of symptoms. The chances of accurately picking up the antibodies will take at least 12 days. So most of the antibody tests are recommended only 12 days after the onset of symptoms, preferably after 14 days. So we don't use it to diagnose an acute infection. It is more useful in serological testing to see what the immunity in the general population is, or to check whether in the past you could have had the infection. But if it is done after 14 days, the chances that it can be accurately picked is high.
Yeah.
Dr. Ram, I have a question.
Before that, I would request Bothra, please, Bothra, kindly mute the people. Constantly there is some irritation, some noise from the background. Somebody has to do something about it.
Yeah, Dr. Ganapathy, you can talk now.
Yes, sir.
Yourself,
Yes, sir. Sir, you were telling about the loss of smell and the loss of taste that usually goes out within a very short period of time, and it just fades away very easily. Because one of my friends, she had it for about 3 days, and then she was perfectly all right. After
I'm sorry, you're muted.
Ganapati, I think you've been muted. Please repeat your question.
Just halfway through, it was muted.
Yeah, can I? Okay. It was just that, she had a lot of loss of taste, loss of smell also. And then that was there for next about 2 to 3 days she had. And then she was perfectly all right. There was no fever. Little bit of body ache she had. But then after about 4 to 5 days, I called her. Now she said, I'm perfectly all right. I'm back to work. So that means that the symptoms have come down. And you said, initially in your talks, you said that's the most, the lightest of symptoms that you can ever get. Is that the way that you have to take it, sir?
No, I wouldn't say the lightest of symptoms. I said that one, loss of smell and taste are quite specific for COVID. So even if they don't have other symptoms and they lose their smell, I would strongly suspect COVID. 2, the loss of smell may recover anywhere from 3 to 5 days, but I've seen some people after 3 months also, they still haven't recovered their smell. It's mainly the smell and also the taste secondarily. 3, those who have loss of smell generally do well. In other words, they don't run into complications of hospitalization and other complications. They recover in 3 days or 5 days or 7 days. So it's a good sign when you lose the smell.
What is the reason for the loss of smell and taste?
See, the virus goes through the nose and the smell tissue, you have the olfactory receptors on the top of your nose. So it is believed that as it enters, it causes some inflammation in the olfactory epithelium, which leads to loss of smell. And secondarily, the posterior part of the tongue, because of this, the taste is lost there. So that is the reason a lot of people have increased salt perception or lack of taste for certain foods, along with the loss of smell.
What are the chances of reinfection?
The loss of taste also will take its own sweet time to come back, sir.
Yes. Generally, couple of weeks it comes back, but I have seen women with more than 3 months of loss of smell and taste also. The question,
what are the chances of
Doctor,
reinfection?
I have a question. Yeah. Can I ask Praveen?
Yeah, go ahead.
Yeah, go ahead.
Dr. Ram, is it unsafe to go to doctors' clinics, hospitals, labs, or even pharmacies, because more chances of exposure and getting the COVID?
It's a very pertinent question, but provided there are certain norms which are followed, which include physical distancing, which include wearing of masks for everybody, which include checking the temperature for anybody who comes to a public place, whether it is a hospital or a shop or whatever, if these are followed, and especially to do with hospitals, certain infection control precautions. For example, the government has recommended that there should be what is called a fever clinic in all places of clinics, where those who have fever are seen separately. They are not mixed with somebody who comes for a blood pressure check or a diabetic check. If these are followed, the risk is very low. Normally, people are very worried to go to hospital, but if it is a hospital which is ensuring that there is adherence to these infection control precautions, the risk is very, very low in hospitals. So
what about labs?
Same thing. If there is physical distancing, if people are all wearing masks, using hand hygiene, there is no issue.
There's a question. What are the chances of reinfection?
As I said, anybody who recovers from the viral infection, even though the immunity or antibody level may not be high, they may have a low immunity, still it is believed that reinfection at this point is less likely. For at least 6 months, which is what we know about the virus, the person cannot get reinfected. But about long-term prevention, we don't know.
Is social interaction to be avoided? Generally, going to other people's houses and all?
You are welcome to go to other people's house, but make sure you sit at least 6 feet away and make sure you wear a mask, both of you. This may be your next door neighbor, this may be your friend living one floor beneath yours, but anybody who is other than somebody living in the same household, if you meet, both of you should be masked. This is a simple rule of the thumb. Your wife, your mother, your daughter, son, when you're staying in the same house, you don't need to be masked. But when you step out of your house, everybody needs to be masked. Anybody who comes, he may be make sure you wear a mask within 6 feet of the other.
Okay, thank you.
Yeah. Can I ask a question, Praveen?
Yeah, Venkatesan, yeah, go ahead.
Yes.
Or anything when you
Good
order
evening,
from
doctor. Good evening, doctor. I'm Venkatesan here, Narasimhan's brother.
Yeah.
Thank you for that very lovely presentation. So, mention an additional risk through the delivery person, because people still have reservations about ordering food.
No, as I told you, there is a theoretical risk that the virus is spread in three ways. One, droplet transmission, which is the highest within 3 to 6 feet of each other when you are not masked. Two, through fomites. Suppose I have COVID, I may be asymptomatic, I may have touched my nose, I touch the pizza box in which I give you the pizza, you touch the pizza box and you take it to your nose, you can get it. That's a small possibility. So these things we generally say, if you get a pizza, wipe the box down, wash your hands, open it, eat. Most of the food is generally warm, so it's unlikely that they'll be contaminated. The third way is through airborne transmission. If especially the hospitals are done, which causes the virus to become smaller and travel through the air, that is at risk. Somebody is on a mechanical ventilator. If you go into the room, even if you're 6 feet away, due to certain procedures, you may still get it. In public areas, this is very unlikely. But again, theoretically, in a closed air-conditioned room, if two of you are sitting, even if you're 6 feet away, prolonged sitting in the same room, if one of you has and one of you is speaking, can cause it passing through the air. So small risk. So food, other things, even if you get prepared from outside.
Thank you.
Question, Dr. Ramasubramanian. There are asymptomatic carriers. What are the chances of transmitting the disease? This viral load.
Yes, they do. Asymptomatic or mildly symptomatic people have a lesser viral load in their throat, but they still can transmit.
What percentage?
I don't think we can say a percentage. We can only say that the risk is much lower than somebody who is unwell. But having said that, if you are universally physically distancing and wearing a mask, whether they are asymptomatic or symptomatic,
Yeah, Ramasubramanian, I have a question for you.
Please mute, please. Please mute.
Mr. Muthuswamy, sir?
Yes,
Go
sir.
ahead.
Oh, okay. My doctor, it's a very nice presentation. My question is, I am seeing morning walk, so many persons are not at all wearing masks. They are not bothering about that. Another thing, they are not at all maintaining social distancing. They are going in group. What is the advice for that?
See, we can only advise people. If people don't listen to advice, then I don't think we can do anything about it. See, what is we advise people not to go to crowded markets, not to go out without a mask. But what happened, which led to the sudden increase in Chennai, was everybody was wearing masks on the chin or on their throat. In fact, I've seen a lot of WhatsApp messages saying like wearing your mask on your chin or neck is like wearing an underwear. Everything visible outside. It is just the same. It doesn't serve the purpose. So unless people have individual responsibility and civic responsibility, getting over the pandemic is going to be very difficult.
Very difficult.
Okay, thank you, Doctor.
Absolutely. It's a very good
Ramasubramanian, I have a question for you. So this is more travel related. So this COVID-19 virus is supposed to have about 6 different kinds of antigens, and different countries are testing different antigens. So if somebody has got infected or tested by one method is negative, so probably in the US he's positive. Now, and in other words, like you're infected here in India, do you have a chance of getting infected in US if you travel to US again?
All the tests are standardized. Even there is the possibility of different tests being used.
Please mute. Please mute.
It is still likely that
Doctor, you kindly unmute yourself and talk, please.
So I was saying that all tests are standardized and you need not worry that your risk plays a negative in the other. Even if antigens are checked for, it is still checked.
Praveen, Mukundan, can I have a question?
Audio is very low.
Audio is very low. Able to hear him.
Doctor, can I ask a question? Doctor, this is Muthu here.
I think we have an issue with the audio now.
But district governor wants to ask a question.
There is an echo.
Botra, why didn't you address that problem?
I will.
They unmute themselves only.
Doctor, am I audible now?
Yeah, Ramsub. I think we just need to repeat the answer again.
No, regarding the question of yours regarding the antigen in different tests, I said that the tests are all standardized, so you need not worry. Even if different antigens are picked up, there is a cutoff by which they detect it. You need not worry that one may miss and the other may find. They are standardized tests that you need not worry about that.
Okay.
Now I will read out the question and then say the answer. That will be easier. I have the chat box open. There is a suggestion that the thermometer should be used on the wrist and not forehead. What is your view? The forehead is, at least for me, it's a very broad place. So the chances of getting a nice area and getting a better answer would be better rather than the wrist. Nice area and getting a better answer would be better rather than the wrist. And the next question is, please elaborate the protocol when we get vegetables from outside and food orders. I think I've said that as long as you wash them with water and wash your hands after you touch them, there is no concern. When a person is staying under home quarantine and assuming he's having infection of COVID with fever and loss of smell and taste, what are all the probable diet and medications they should take? There is no specific diet. You can have a normal diet. With regard to medications, most medications are only supportive, which means if you have fever or body pain, you take paracetamol. You can take one tablet of vitamin if it makes you feel good. If you are having a congested nose, you can take an antihistaminic like cetirizine. And if you have severe cough, you can take a cough suppressant syrup. Apart from this, there is no other specific medication which is recommended for outpatients who are otherwise stable. What precautions should housemaker take at home? Nothing. If you have people coming into your houses waiting for example, maids or other people who are helping you, the recommendation would be make sure that they are masked when they are in the house. If they are sweeping or mopping in one room, the other people, especially the elderly people, should leave the room, stay physically distanced and ensure that they wear a mask when they work, because you don't know how strict they are outside the house. They may be going to other places without a mask. So you treat anybody as person who could have COVID and ask them to stay physically distanced and wear a mask. Otherwise, no specific recommendations. Can you please tell us what precautions a patient having lung issues or lesions should follow this time? There is a basic minimum which everybody should follow, which includes physical distancing and wearing a mask if you are coming close to anybody. I see people who say that they follow everything, but when you go to their office, because they are friends and they are working together, they don't wear a mask. In my department, all of us, except when we eat, we all wear a mask. If we meet somebody in the same room, it could be my registrar, my colleague, we still stay masked when we are close to each other. And this should be the discipline everywhere. Any office, except your house, except those people who are living with you, anybody else should be considered as having possible COVID. Is there a possibility for rapid antigen testing, which can save time and is easier to perform? Yes, the rapid antigen testing is less expensive, but it still requires a nasal swab. So it is done similar to an RT-PCR. It is less expensive, but it is less reliable also. The reliability is only 30 to 50%. So if we suspect COVID and do the antigen test, if the antigen test is positive, it confirms. If the antigen test is negative, we still have to do a RT-PCR. So it has its limitations. What is the risk of traveling long-haul flight? In fact, flights are one of the best ventilated systems of transport which we have available. So still a person, two seats in front of you and two seats behind you and two seats on either side, is at risk from the person who is sitting in the middle. So if you have to go long haul, always wear a mask, use a hand sanitizer and wash your hands frequently, avoid taking your hands near the face, and as far as possible, physically distance yourself whenever possible. That's the only thing you can do. A person on tablet HCQS for lupus, does that protect them from COVID? As I told you, HCQS was believed to help, but there is no definitive evidence except for one study which ICMR has done. So we can feel that it helps, but there is no scientific evidence. Taking Kabasara Kudineer Churanam every day, does it help? I am an allopathic physician. I don't know about Ayurveda and homeopathy, so I don't want to say anything which may or may not be right. Mr. Narayan Swami says, my nephew has come from Mumbai. Should he be on home quarantine? These things I will leave it to what the recommendations from each state is. So there are some states which say 14 days, some states which say 7 days, some state we say that you should be home quarantine, some states say facility quarantine. So the only advice is, if they have been at risk, ensure that they are at least isolated in some manner for 10 days before they are exposed to elderly people at home. Should we avoid travel in flight? As far as possible, avoid. But if you have to travel, travel with as much precautions as I told you earlier. Precautions for a pregnant lady. Surprisingly, the good news is pregnant women have milder infections. Unlike flu, where pregnant women have severe infections, with COVID, pregnant women are spared. They may have only mild infections, so you need not worry for pregnant ladies. And similarly, young children have mild infections. It's the elderly who run into complications. So young children, pregnant women, even if they get the infection, you need not worry that they run into complications. What about a second wave and mutations? Yes, it is inevitable that there will be a second wave. Whether it will come 3 months later, 6 months later, we don't know. It is believed that mathematical modeling has told us that every time one wave comes in, about 30% of the population gather immunity, which is what we have seen. Delhi about 23%, Bombay about 30%, Chennai also about 25%. So one wave will give immunity to 30%. So it is believed that at least 3 to 4 waves are needed before the herd immunity of 60% is reached. And we, as I said, we will have a lot of deaths by then. So we hope that a vaccine will come before that.
Can we have a question from our district governor, sir?
District governor, yes, sir.
Yes, sir.
Please
unmute.
Doctor, it was a nice presentation, very comprehensive. We could take a lot of message from you. On a lighter note, one way to avoid COVID for women to let them get pregnant. It looks like they are safe now. Doctor, I could see all the paramedical and doctors getting tired of wearing this PPE kit. And for months they have been wearing, and it has to continue for another 8 to 10 months, it looks like. What is the way forward, and how are you managing? And what is the risk element involved in terms of when they remove the PPE kit? No?
It's again a very pertinent question. When you doff the kit, we call it as doffing, removing it, there is a significant risk if you don't remove it properly, because the outer side of the mask will be contaminated, your gloves will be contaminated. There is a proper protocol for removing. You remove the gloves first, use alcohol gel, remove your gown, then you remove your mask. So you need to adhere to this properly. And unfortunately, for various reasons, either because of the size of the personal protective equipment is not correct for the person, he doesn't know the doffing protocol. As I told you, a lot of even healthcare workers wear a regular mask and then wear N95 on top, which is incorrect. So for all these reasons, healthcare workers put themselves at risk. And it is, I will tell you, it is miserable wearing a glove. I wear a glove at 7:30 in the morning, and except for drinking water once or twice in between and having lunch for 10 minutes, I remove the mask at 5:30 or 6 in the evening, and it is not pleasant. It is miserable working with these conditions. So I'm happy you raised it, and it is something which we have to do anyway.
Dr. Ram, if a person tests positive in a household, should you test all contacts?
Very good question. The highest risk of transmission is for household members, as high as 40%. So if a household is infected, one person is infected, everybody in the household should be quarantined. You cannot let the other people go out. They will spread the infections, asymptomatic or otherwise. So the recommendation is quarantine everybody for a minimum of 10 days. And if they are symptomatic, do a test. If they are asymptomatic, make sure that they are quarantined for 10 days. Because what sometimes happens is when you tested positive, the other members are tested after 2 days. And if they are negative, they take it easy. But they may get the infection after 3 or 4 more days. So make sure that they are quarantined for 10 days. And if they are not symptomatic within 10 days, it is recommended that they do a test on the 10th day before you can ask them to release quarantine.
So after 10 days, you have to do it, is it, Tom?
Sorry?
They are asymptomatic. And after 10 days of quarantine, they have to do the test?
Ideally, that is what is recommended, because I will tell you, I get it today, and I told you the incubation period can be up to 10 to 14 days. So the maximum is less than 10 days. So my sister or my brother who's exposed to me today may test negative tomorrow or day after, but may become positive on the 10th day or the 11th day. So which means after that, if you have not checked them or not quarantined them, they may pass the infection to others. So ideally, you need to recheck after 10 days for people who are asymptomatic.
Asymptomatic. Good.
Second wave is over.
Yes.
My brother is having cold continuously for 2 months, no other problems. He's 60 years old, afraid to go to the hospital. 2 months, he's definitely not having COVID because cold is not a symptom and he's otherwise fine. But he can go to the hospital provided he wears a mask and goes preferably to a place where you have no crowding and where they adhere to infection control protocols. How safe is it to go to a reputed saloon in Chennai now? As I told you, we have reached a stage where we have accepted the pandemic, which means we have to move on, but we have to be disciplined. So you have to be masked. You have to ensure that you use alcohol sanitizer. When you go to a saloon, make sure that the crowd is very less and they have good ventilation. That is the best way to ensure that you stay safe. How safe are young children below 5 years? Children have a lesser risk of getting the infection, but they have a higher risk of transmitting the infection, especially to the elderly, because they have mild symptoms and they may continue to shed the virus. So you need not worry about the child, but if the child is unwell, I worry about the grandparents. Does Jalaniti practice help? I'm sorry, I don't know. I'm flying back to Chennai next week. Is it mandatory to wear a PP or will mask, face shield and gloves be good enough? PP is not mandatory. Wear PP other than a mask if I'm going to go close and examine a patient, a face shield. Otherwise, I don't even wear gloves. Mask, I make the patient sit at least 5 to 6 feet away. If I'm going near the patient to examine, they should also be masked, of course. If I touch the patient, I use alcohol sanitizer before I come back and sit on my chair. Strict discipline is the only way to stay safe.
In ophthalmology, we have
useful is the
ophthalmology, you need to wear a face shield, definitely.
No, I use the PPE kit as well because I'm very going close to the patient, no?
No, it doesn't matter. The chance that you may pick up something on your dress is very, very less likely. That to a patient who's not having COVID, Assuming that you have to treat as everybody as possible COVID and take the bare minimum of precautions for everybody.
Then I have a question to you, Ram.
Yeah.
No, you're talking about the flu and other viruses. The other viruses don't have these various manifestations. For example, we see many patients having vascular complications, thrombosis, pulmonary embolism, cerebrovascular strokes also, accidents also, myocarditis, heart attacks, and we have reported patients with, of course, similar to the Madras in coronavirus, number one. That is, of course, quite common as adenovirus as well as coronavirus. We also reported one case of cavernous sinus thrombosis due to coronavirus. And we are publishing it as well, along with Mohan Kameswaran. So what is the reason for this multifaceted, manifestations of this coronavirus, unlike the other viruses, like the SARS virus, we don't see like this. We didn't see any of these viruses like this.
It is still very puzzling. We don't know. In fact, some people say that coronavirus is actually a systemic virus with predominant respiratory symptoms. It affects all the symptoms. You can get heart attacks, you can get strokes, you can get, abdominal presentations. We have seen it all. During times like this, anybody who presents to the hospital for whatever reason, you have to have a strong suspicion of a possible COVID. There is still a lot of things we need to learn about this virus. At this point, we are only realizing that there are a lot more to it than just cough and fever and breathlessness. but hopefully we'll know better with the evolution of the pandemic.
Doc, can I have a question?
Yeah.
Can you hear me? Can I ask a question?
Yes, Jacob.
Yeah, I just want to know, doctor, that increasing the immunity now, everywhere the fad is that you have to increase your immunity by so many kinds of this thing, because the most fittest person like Usain Bolt as well as Djokovic have been affected by this corona. And what is your comment on that, doc? Increasing your immunity, does it help preventing COVID?
I told you very clearly that the only 5 ways to improve immunity is good nutritious food, sleep or rest, vaccinations, exercise, and minimizing the stress. Beyond this, all the other ways of improving immunity are very nice to hear and probably may help, but definitely not proven. So this is the only way you can stay safe.
%40 of RT-PCR may be negative. So should we rely only on clinical findings, a CT chest or the COVID markers to make a diagnosis?
You need to have a mixture of everything. Currently in Chennai, any fever or any presentation to the doctor is COVID unless otherwise specifically diagnosed. That's a first dictum. Use the clinical presentation, ensure that you do the COVID test where it is indicated. And in some situations, we do a CT scan of the chest also, because CT scan is non-specific, but it picks up a lot more than the nasopharyngeal swab. Almost 85% it can pick up, but it is non-specific. So we mix all three to come to a diagnosis. If in doubt, treat as COVID, make sure that infection control procedures are adhered.
What about D-dimer and all, Ram? D-dimer?
They are all non-specific. They are all very non-specific. Based on that, you cannot high CRP, D-dimer, no, not dependable. I think of only the COVID test and the CT scan.
Based on the CT, Ram, I just want to ask you one question. Based on the CT, can you predict that this patient will not do well, this patient will do well, this patient will progress?
You can.
Or is there any other marker for you?
You can intuitively or logically consider somebody who has a significant involvement of more than 50% as likely somebody who will do badly. But I have seen people with very minimal changes on the first CT in a matter of 5 days deteriorate very badly. I have seen patients who have a 50% involvement being steady and they recover completely. So none of this is, we are having very bad surprises with COVID.
Okay.
Dr. Ram, when we employ domestic helps or drivers, are there any guidelines?
No, routine testing for these people is not recommended, because how often will you test? How frequently will you test? We don't know. The only thing is, if you have a driver, the best way is to make sure he's masked and you are masked when you're traveling in the car. Avoid the AC so that there is good ventilation. That will be the safest. Maids, as I told you, ensure that they are masked when they are in the house and avoid being in the same room when they are also doing some work. That's the only way practically you can keep safe.
Usefulness of a face shield.
Face shield is recommended if people are going to be close to you so that if they speak, it doesn't go through the eyes. If you wear a face shield, a mask is also recommended, especially for healthcare workers who are going to be close to other people. Wearing a face shield alone without a mask, not recommended, not as effective as a mask.
Or you can have a mask and a
pneumococcal vaccine and influenza vaccine, does it help or no?
It's got nothing to do with COVID, though there are speculations that the flu vaccine may stimulate a non-specific immunity and help protect against COVID. As of now, it only prevents flu. Flu may coexist with COVID. So ensuring at least you can prevent the flu by a flu vaccine is what is recommended. Pneumococcal vaccine also, because COVID can go to anybody. A person with COVID can develop pneumonia. A person with pneumonia can develop COVID. So you try to prevent using vaccines, whatever is preventable, but there is no direct protection against COVID from these vaccines.
Doctor, I have a question. In case we are calling somebody over home, and what are the precautions for, right now we are taking masking ourselves and all that stuff, but during the time of eating, if we are going to sit together and eat, what is the precautions we can take? I mean, you can't probably mask yourself and eat. So what is the best?
For questions like this, we have to use common sense, which means having the meal outside the house would be the ideal way. So eat in a terrace, eat in a garden where there is good ventilation. So even if you are reasonably close to each other, you are, you are safe. 2, avoid speaking loudly, because loudly speaking, singing, loud talking, all that increases the risk. So don't have any ambient music. You have music out here and you scream at each other, increases the risk. So try as much as physical distancing, keep it outdoors, keep it in a quiet place where you talk softly. Those would be the simple things.
Thank you.
Questions, please.
Yes.
Is it okay to go to a saloon? The last 6 months we've not been around there. And what is it? Any place in Chennai where we could safely go? And
No, I am not going to recommend any places. I will get into trouble. But any salon, as I tell, where there is less crowding, where there is good ventilation, where the person who is shaving or cutting your hair is masked, and you also can mask your face, whenever it is feasible. That's the only way forward. But I think we have to start moving on with some amount of discipline. That's all.
Tremendous talk.
Any more questions?
Tremendous. Fantastic.
Thank you. One question. I think measles vaccine has got any immune action? No studies. That's association. BCG vaccine. They are studying in elderly people right now, but not yet.
Yeah, we have one more question. Like, they want to know, once you come back from work, is it necessary? I mean, if it's enough if you just wash your hands, or you need to take a bath?
Half an hour and come back, I don't think there is a reason. But if you're working the whole day, I think, and exposed to a lot of people, again, common sense tells me that shower is.
I need to have a bath.
Is that over?
Rajamanikam, unmute.
Yeah.
Yeah. Good evening, doctor. When we go out for walking and all, we cannot go to a place where no one is there. When we are going there, if they are not wearing mask and they are walking, how should we safeguard ourselves, doctor?
As long as the person is not talking, singing, whatever, the risk is very, very small. If you pass by somebody who is, unmasked, the risk is very, very small. So you need not worry too much.
Okay, doctor.
Doctor, the patient has recovered. When can we donate the convalescent plasma?
General recommendation is after 4 weeks. That is when you think that there is some amount of immunity. There's still a lot of studies going on, but 4 weeks is what is currently recommended.
And what will be the screening protocol with the outbreak of dengue and the H1N1 season?
Very difficult. Only thing is you can consider it as COVID and isolate the patient. Meanwhile, you work up to see whether it is likely to be dengue or malaria or typhoid. Don't assume it is malaria and keep quiet, because by the time you realize it may be too late, he may have already spread it to a lot of people. Consider every person as COVID with or without fever and take the precautions which are basic and necessary.
Thank you, sir.
Doctor, is the immunosuppressed under mild steroid be as safe as the elder person?
In general, immunosuppressed people are probably at a slightly higher risk. But having said that, what immune suppression, how much? I'll give you an example. I see a lot of patients with chronic kidney disease on dialysis who are generally immunosuppressed have very mild infections. These chronic kidney disease patients, especially when they do dialysis, the risk is higher. A lot of people are asymptomatic and they pass it on. But these people, in my personal experience, don't have any severe problem. So why is it? I don't know. So it doesn't generally mean that all people who are immunosuppressed do badly, not necessarily.
Is it because of dialysis it's giving some immunity to them?
Anybody's guess, I don't know.
Yeah. Okay. Very nice, Ram. Fantastic. I think we are all give a big round of applause to Ram.
1 second, doctor, please. Can I have one thing?
Yes.
For the dental doctor, what is the safe thing to do, doctor?
Dental, actually, the dentist is at highest risk if you have asymptomatic or symptomatic infection. So again, When you enter the clinic, they should screen the temperature, use hand wash, make sure that everybody is masked. The dentist will assume that every patient has COVID and take precautions. Wherever a procedure is being done, a dentist should ideally get a clearance from a physician to say that they are fine, because they may be missing things. All these are mandatory, and there should be a protocol where the dental room is well ventilated and they use infection, they whatever, use autoclave their instruments, make sure that all infection control protocols are adhered to. It will be safe.
Thank you, doctor.
I can tell you my clinic, it is very safe.
Thank you, doctor. Because my daughter's dental.
Yeah.
Are there any more questions?
Doctor.
Can we finish it up with questions or any more questions?
Ram, you are really patient and you have answered all the questions, and also the chat box has been answered. Really thankful.
Thank you so much, Ram sir.
Thank you. Thank you.
Thank you, Doc, so much.
Registration by DG.
I request our district governor, Muthu Palniappan.
Thank you, Dr. Ramasubramanian.
Thank you very much, DG, for joining us. Now we request you to say a few words in felicitating our Dr. Ramasubramanian, the awardee of today's Vocational Excellence Award.
Yeah, President Shyamkumar of T.Nagar, Madhusudhan Secretary, and Vocational Chair Srinivasarao. And most importantly, the awardee, the person who is really made the day, Dr. Ram, by conferring the Vocational Excellence Award upon Dr. Ram, Rotary Club of Madras, T.Nagar, and the RA District 3 to 3 is honored, I would say. We are honored, Doctor, by giving award to you. We are honored. I congratulate Dr. Ram and thank him for the exemplary service he has been giving to the community for many number of years, and most importantly during the COVID times. Everywhere in Chennai, we are hearing the name of Dr. Ramasubramanian. Whenever we talk about COVID, whenever we talk about Apollo, the one name that comes to all of us is Dr. V. Ramasubramanian. I have not seen such a comprehensive presentation for COVID in terms of do's and don'ts, prevention and treatment for COVID. Complete spectrum of aspects of COVID is completely covered today. And all of us are really thankful to you. And when I went through the Google, I saw his capstone clinic believes in ethical and holistic health practices, which is rare today. That is Dr. Ram for all of us. Thank you, Ram. We really appreciate and congratulate you for accepting this award. And I appreciate T.Nagar for selecting such a wonderful awardee for vocational excellence. We cannot ask for a better person in the medical fraternity today in this testing times. Thank you.
Thank you, DG Muthu Palniappan. Thank you very much, sir. Now I request Dr. Madhusudhan for the Secretary's announcement and followed by vote of thanks.
Good evening, one and all. We have initially sad news that we regret to inform the sad demise of father of our senior Rotarian, Mr. Ravi Venkatraman. Heartfelt condolences from the RCMT family. There are two meetings this month, September 3rd by our senior Rotarian, Dr. Mohan Rajan, who is also the chairman of Project Orange, Eye Donation Awareness Talk, which is involving the National Eye Donation Fortnight. September 17th, we have a speaker meeting, Annadanam, on September 6th at All the Children Center, sponsored by our President Shyam on the occasion of his birthday. The announcements of birthdays, 28th August, Kamakshi Annette of Rotarian Kapil Kumar Maheshwari, and 20th August we have Anne Arudra Mathur, wife of our Green Rotarian Rajesh Kumar. August 30th, Vignesh Annette of Rotarian Srikanth, Rotarian Ramanujam, and Rotarian Srinivasamurthy. Wedding anniversaries, 28th August, Rotarian R. Krishnamurthy and Anne Kanagam, 30th August, Rotarian A.S. Kumar and Purni. It gives me great pleasure today to say the vote of thanks. It's a pleasant task for me. On behalf of RCMT, I thank Dr. V. Ramasubramanian, renowned infectious disease specialist, for having consented to accept the Vocational Excellence Award from RCMT and for giving the keynote address. When we met him earlier last week to invite, Dr. Ramasubramanian readily accepted without any hesitation. We are all aware, sir, that the pressure of your work in treating COVID patients and conducting webinars every day. And in spite of this, you accepted at very short notice. The medical fraternity is always grateful to you for giving clear guidelines in treating COVID patients. Dr. Ramasubramanian was instrumental in grading clinical disease into mild, moderate, and severe cases of COVID, which enabled us to treat patients in a better manner. A true professional who has been very keen in spreading knowledge to the community, and you have cleared our minds and doubts and instilled confidence to face the pandemic, sir, without fear. I also thank all the district officials who have gathered here, PDG Isaki Nazar, PDG Chandrabab, AG Amrut Raman, AG Mahendran, District Secretary Rotarian Ramesh, District Officers Rotarian Muthuswamy, Rotarian Venkateshan, Chairman Membership Rotarian Raghavendra Rao, TGR Rotarian Annamalai, senior and other senior district officers, and Rotarians from District 3232, all presidents and secretaries. I really thank you for joining us and making this a very useful interactive meeting. The key person to thank is Dr. Praveen Talakula, who arranged for our meetings with Dr. Ramasubramanian and successfully got this event through. Thank you, Dr. Praveen. I thank President Rtn.Shyam and team, Rotarian Mahavir Bothra, for organizing this Zoom meet. Dr. T.S. a club advisor. Thank Senior Rotarian Mohan Rajan for presenting the citation. Rotarian Inturi Srinivasarao, Director of Vocational Service. Thank Senior Rotarian Jacob Rajkumar for being the MC of this evening, and Tapasya for coordinating the question answer session. I thank all fellow Rotarians, aunts, aunts, and friends, relatives, and invited guests who made this event a successful evening. Thank you once again, Dr. Ramasubramanian, for a wonderful evening with us. Thank you.
Thank you, sir.
Thank you.
Thank you. Thank you.
Thank you.
Thank you, Dr. Ram. Thank you.
Thank you very much.
No national anthem.
Thank you
That's already-
all.
Thank you, sir. The time is 9:05. No national anthem. No.
Okay, then I request the president to adjourn the meeting.
Okay. Thank you.
Yeah. Thank you all. Thank you all who have participated today, and it's been a wonderful evening. Very, very, very important, which is really concerned about our life and well-being. Thank you, Dr. Ramasubramanian, and the meeting stands adjourned.
Thank you.
Thank you.